Well, thank you so much. For those of you that don't know me, my name is Cioè Peña. I'm the Director of Global Health at the Center for Global Health in Northwell, and it is my honor to be moderating this panel today. We have two very exciting guests with us today. I'd like to introduce Dr. Stanley Prusiner, who is a Nobel Laureate and the Director of the Institute for Neurodegenerative Diseases and Professor of Neurology at UCSF, and Dr. Frank Anthony, who is the Minister of Health of the Guyana. Thank you both for being here today. As you know, this moderated panel is on global health, innovations, and technological solutions to problems that we have in the global theater. So I'm going to start with Dr. Prusiner. If you don't mind just briefly giving us an introduction to your work, what you're either something you've done in the past or something that you're excited to be working on now, and how it relates.
Well, I've been working on one problem since 1972, and that began with a patient who was dying of Creutzfeldt-Jakob disease. And I wondered what was the cause of this disease, because there were studies on a disease of sheep and goats called scrapie. And it was some very strange something, and nobody knew. And with time, I worked on this and was able to remove all the junk and purify the infectious pathogen, which I named prion because it was only a protein. It was different from a virus, different from a bacterium, different from a fungus, different from a parasite. There was no precedent for a protein doing everything that looked like a virus. And so that's where I began these studies, and I've been working on the same thing. But over the past 20 years, I've focused on trying to develop therapies because prions cause Alzheimer's disease, Parkinson's disease, and many other less well-known neurodegenerative diseases. And at the moment, we don't have one therapy for Parkinson's that actually is effective and stops the disease. And we don't have one for Alzheimer's disease. And my view of this is that a lot of people have been going down the wrong track. And I think you can see it with the world of antibodies, where people have been trying to say, okay, antibodies are what cause, what our people think that antibodies should stop these diseases. And so drug companies keep pouring billions of dollars into this, and it doesn't lead anywhere. And we can talk about that more later. I'll stop.
Sounds good. Thank you very much. Minister Anthony, do you want to give us some brief words of introduction?
Well, thank you very much, Eric. It's a pleasure to be here with you. I'm the Minister of Health here in Guyana. I've been working in health for quite some time now, and at different levels of the system. I've had the pleasure of now being able to work on the transformation of the health sector in Guyana. So part of my job is to build new hospitals, set up new laboratories, putting in imaging, try to connect some of our rural areas so that we can have better patient care in these areas. So it has been quite exciting over the last two years, and I really enjoy doing that.
That's great. And, you know, one of the things that we're focusing on in this panel is just some of our understanding, obviously, of, you know, how we can leverage technology in the healthcare sphere with the invention of AI, with the creation of these kind of smart machines that can, you know, we can 3D print our way out of, you know, not being able to use a ventilator for more than one patient in COVID. You know, we're seeing kind of technology slamming into medicine in a way that really, I think, is unprecedented. Are there instances in either of your careers where you've seen that have a really prolific effect? And or is there something in the future that you're looking for that you're hoping that technology will solve? And I'll start back again with Dr. Prusiner, and then we'll change up the order.
So I think for my own work, there's been an enormous transformation. And it's described in detail in 2017 with the award of the Nobel Prize for what's called cryo-electron microscopy. And cryo-electron microscopy is capable of determining the exact position of atoms in a large protein that becomes a prion, or not a prion, just a so-called normal protein. And this technology is revolutionary. For years and years and years, people were trying to find out the positions of atoms by doing two things: crystallizing proteins, so they were absolutely pure, and then they would form and the protein would fall out because it was at such a high pure concentration that it would then form a crystal. And then people would use X-rays to determine the exact structure, so they knew where every atom was. But it turns out with these diseases that we call prion diseases, like Alzheimer's and Parkinson's, these diseases, the proteins cannot be purified in this way, and you get an artifact. So cryo-electron microscopy for the first time reveals where each atom is, and we see these fibers that are made up of huge multimers of prions, all folded one after another in a long chain, and we can see exactly what they look like without modifying them, which means that we can go after these proteins with drugs that actually work. And for the first time, this is really a reality, and we're very, very excited. And many other people are working on this now. We're not the only ones. Let's be clear about that.
That's really exciting. Minister Anthony, where would you see kind of technology, I think, impacting your transformation of Guyana's healthcare system?
Well, first of all, I think there are quite a lot of ways of using innovative technology. For us here, one of the things that we have been doing is using telemedicine. So we have been using telemedicine to connect our hospitals with the rural community. In many of these rural areas, we do not have doctors, we do not have a lot of skilled people at that level. So we've actually started putting in the internet into some of these small health centers, and we have given these communities internet-enabled devices. So a community health worker can now help a doctor in Georgetown, or connect to a doctor in Georgetown, and that doctor can walk them through the paces with the patient, and to be able to then listen to the heart or use the ultrasound probes to see what's going on with that patient, and then help them to make a more accurate diagnosis. By doing that, then we are able to provide better health care in these rural communities. We have also been working on doing telepathology. So we have high-resolution cameras that we would take a photograph or image of the pathology sample, and then we are able to send that to someone who can read the image. In that way, we are getting fast turnaround time in terms of understanding the disease entity that we're dealing with. And so that is going to help us to improve in a lot of ways the way that we diagnose cancers here. We have also been using PAC systems to be able to bring medical imaging from the periphery to Georgetown Hospital, which is our main referral hospital. And a team there can be able to interpret these images and then send back the results to the doctors in the peripheral hospitals. So this is just one way in which we have been, or a couple of ways in which we have been utilizing technology to help us to improve the quality of health care that we are offering to our patients here.
That's great. Those are some great examples. I've always said that depending on how you use technology, it either will close equity gaps or it'll just reinforce them. And that sounds like it's a tremendous way to really close an equity gap between the rural communities and the city. So that's impressive. I'm going to move on to a new topic. I wanted to ask you both if you can think of any example where a local approach could be utilized for something larger than just the local solution that you were looking towards. So in other words, by local, I mean within your field. So are there advantages in, Dr. Anthony, for you, public health, and Dr. Prusiner, for you in the study of prion disease that translate to other parts of medicine, other parts of public health, or other parts of science that you think are valuable to mention? And I'll start with Minister Anthony.
Yeah, so I think one good example that we can use here, for many years, filaria has been a problem for the population here in Guyana. And it is considered one of the neglected diseases around the world. And so we have been able to use mass drug administration to reduce the parasite burden in people across the country. And I think this is one good example because we have achieved really good results here. And right now we're doing some assessments to determine whether we still have high levels of parasite in the population. We are not finding that, but we are going to do periodic assessments for the next couple of years. And we are doing that with the help of PAHO and the WHO. But I think this is one example of how you can eliminate a disease. And perhaps what we have been able to achieve here can be replicated in other countries of the world that still have filaria as a problem. So we are willing to share those lessons with others.
That's great. Thank you. Dr. Prusiner.
Well, at the risk of becoming too technical, I will say that there are a number of people in the world who don't believe that prions cause Alzheimer's or Parkinson's. Now, they haven't figured out what it is, but they want to live in this ignorance. And so I'm not very kind about this, as you can tell. But having said that, I think, we'll see, unless I'm wrong, and I could be wrong, that we'll see the transformation in the world. I mean, if we can wipe out Alzheimer's and Parkinson's disease, the amount of suffering that people have that occurs throughout our planet, all over our planet, is just horrible. I mean, we talk about the planet burden for Alzheimer's as 50 million people. And we talk about Parkinson's as about 15 million. These diseases are just so horrible, and we have nothing that we can do that's effective. We have a lot of talk, but we don't have anything effective. So I think, my point of view, this is going to work. I haven't been wrong about this stuff, so to speak. And if it does, and I'm right, well, wow, what a change. That's just going to be fantastic.
What a tremendous impact that would have on even on health systems. I think as we get, one of the curses of developing your healthcare system, and Minister Anthony, you may want to comment on this, is the more developed it gets and the older your population gets, you create new problems for yourself. And so I think a lot of populations that are countries that are now moving into the kind of the high middle income or high income range are now having to deal with these new problems of an aging population with longer life expectancies. And that certainly for the U.S. represents an enormous amount of our global, of our overall healthcare spend. Do you have any comments on that, on kind of what you think solving a prion, if Alzheimer's is, as Dr. Prusiner says, is a prion-mediated disease, how that would change the outlook for a country like Guyana?
No, I've been listening to Dr. Prusiner, and I'm really fascinated by the work that he's been doing. And, globally, with the amount of people affected by Alzheimer's, certainly his work can make a definite impact. And I think there are many diseases, because not much research has gone into them, that, it still remains a big problem for the world. We need more people to get involved in research and to help us to change this, because as you age, we are seeing a lot more of the chronic non-communicable diseases. And this is now becoming the more dominant disease in many countries. Unfortunately for us, we still have infectious diseases and non-communicable diseases. And we have not fully made that transition from one over to the other. So we have like a double whammy here. where we have a broader spectrum of diseases to deal with. And that really can put a burden on the healthcare system in the country. And I think it's true for many developing countries. So while we grapple with these newer forms of diseases, infectious diseases is still a big problem for us.
Yeah, absolutely. And it's interesting. That leads into my next question, which is, what technological changes do you think are ahead of kind of human advancement to those changes? And I'll point out that we're on Zoom right now moderating this session. This probably would be unheard of for the Constellation Conference in 2017, 2018, 2019. But now, because of the pandemic, we've kind of had a crash course in change management for virtual meetings. Do you think that there are other kind of ideological gaps that need to be bridged in order for humanity to leverage some of the technology we've discussed here to its full potential? And I'll start back with Dr. Prusiner.
I don't know the answer to that. I don't know that I can contribute anything to that. I was listening to just a moment ago when you were talking about how many people are involved in all these diseases and trying to look at the manpower issues and woman power issues. And I'm saying to myself, there are at least 30,000 people who work on Alzheimer's disease. It's probably double or triple that. It's an enormous number of people. That's only a small piece of the people that take care of patients with Alzheimer's disease. I mean, that goes all the way from nursing homes, full care, they call it memory care, right? And from there, all the way to people who are just early, who are now going to see physicians. And everybody wants to make sure the diagnosis is either correct or incorrect. And if it's incorrect, let's figure out what it is. But, we've not made much progress in actual effective treatments. We have a lot of talk, and we really don't have effective treatments. And that's really disturbing. And I think that...
do you think part of that is...
We need to think and push. That's all. I have nothing intelligent to say beyond that.
Oh, no, I think you're modest. I have a quick follow-up question before I jump to Minister Anthony. Do you think that part of the not being able to agree, and I know you spoke, a bit controversially about this, but do you think that the fact that the Academy hasn't agreed on the cause of Alzheimer's is one of the major gaps in being able to design therapeutics? Or do you think even if we all kind of agreed with your statement that it's a prion-mediated disease, that we would still be where we are?
No, I think if people were to agree to that, then I think we would have the right experiments that would actually produce the drugs. I don't think that we are going to be at a point where people actually agree on all of this because there have been so many different roads until we actually get the drugs that work. And that's okay with me. That's just fine. But I think that we're going to be in this position until we get drugs that actually work. We have no drugs that work now. So you can say, this is reminiscent of AIDS. Yeah. Right. We had all these ideas about what causes AIDS. Is it a virus? Is it a parasite? Is it a fungus? And nobody was sure. It got better and closer with the idea that it was a virus. And eventually the virus hypothesis won out at the point when drugs started to become available and they actually worked and the patients got better. And that's where we're focused. I think that's where we are with Alzheimer's and Parkinson's. And we'll just have to wait. We'll have to try and push for people who are focused on this to get an answer. I mean, whatever the answer is, that's all that matters. Doesn't really matter whether who's right or who's wrong. What matters is the answer and then a drug or two or three.
No, well said. Well said. And again, you think you're modest by saying you don't have anything intelligent to. I've already learned several things being on this panel, just listening to you speak about this. So thank you.
Well, I can say something humorous, but I won't.
Minister Anthony, same question to you. Do you think that there's a kind of a human mental gap that needs to be bridged in order to fully realize technological advances in Guyana?
Well, first of all, I think there is that digital divide, because for us to utilize some of these technologies, we need to bridge that gap. But maybe looking at perhaps something more globally, we're just talking about maybe inventing new meds for Alzheimer's. But even with the meds that we do have, we have a problem with how that is being distributed. And very often in poor countries, we do not have access to these meds. And maybe that's something on the global stage. If we can find better ways of utilizing, distributing, giving access to the meds that we already have, then maybe we'll be able to reduce some of the burden of diseases that we currently have in the world. But that's something we have to figure out what is the best mechanism to do so.
Yeah, and I think the time is right for that, because certainly COVID has showed us some of the global inequity, even in just vaccine distribution, therapeutic distribution. With Paxlovid, it's been very challenging to get those into low and middle income countries, and even countries that are higher income that have the ability to pay. If they don't have the volume, they really can't get the attention of the manufacturers and distributors. So I think your point's very well made. We're running short on time, but I wanted to ask you both one last question, and I wanted to see if you guys could make any big or bold prediction about your field in the next 5 years. Anything you think is on the horizon that you're excited about, we'll try and keep it brief because I think we're running out of time. But anything that you're excited about that's on the horizon, and I'll start with Dr. Anthony.
Well, looking at some of the problems that we have currently, I think one way that we have to look at these disease burden is perhaps maybe to embrace a different way of addressing them. And maybe instead of looking at diseases, we need to look at getting people to stay well. So maybe wellness, and perhaps that should be a focus. So maybe lifestyle medicine might become more prominent in the near future. So that's something I would really like to see happen, where we can prevent more of these diseases rather than wait until people have them and then try to work with those persons.
Spoken like a true public health advocate. Dr. Prusiner.
Well, I don't really have anything to say on that line of movement forward, because in the next 5 years, you really don't know. There's a lot of luck involved in science. And so maybe in 5 years, we'll have a drug that works in Parkinson's. That's where we hope to be, but maybe it'll be 10. We just don't, we don't know. We don't know how many wrong paths we're going to take. We don't know how many wrong ideas we're going to have. We don't know how many times we're going to bump our heads on something and say, oh my God, we should have done this differently. Now, fortunately, there's a lot of smart people working with me, and a lot smarter than I am. And so they kind of prevent this from happening. And so I'm very lucky. But most of all, I think, we need luck in terms of the science, because if we go down a road, and a lot of smart people have said, this is the right road, but in fact, going down that road isn't going to lead anywhere because we didn't consider something. We weren't quite smart enough. That happens. So it's called luck.
Yeah, and I think with that luck is also giving yourself and your institution, giving you permission to try and fail. I think that's another major kind of thing that I've seen out of greatness is that you fail many, many times before you achieve greatness. And so I think having that latitude is vitally important in both science and public health.
I agree.
I wanted to thank you both for being here today. It's been a pleasure speaking with you. Once again, Minister Anthony, Dr. Prusiner, I very much appreciate your time. And I certainly learned a lot today, and hopefully the audience did as well. So thank you.
Thank you for having us.